Hello, Pittsburgh. I'm Zac Gibson, and this is Trib Lives from the Newsroom podcast, bringing you top stories from TribLive.com. Flu cases are spiking in Western Pennsylvania in recent weeks, and doctors are seeing high numbers of patients with the illness. Some have forgone traditional medicine and turned to alternative practices. While not all remedies work, there are some practices that can shorten your sick time. Megan Swift is here with more details. Hi, Megan.
Hi.
So, it's flu season. I'm sure you and all of our listeners are aware. There's a lot of frustration and stress that comes with that, trying not to get sick. If you are sick, trying not to get someone else sick and all of the different things that come with that. But let's get into this series of stories that you put together while covering flu season this year. So, when exactly is flu season?
Sure. So it fluctuates depending on the year, for sure, according to doctors that I spoke with. But I heard that the typical flu season starts in late December and lasts through March in Western Pennsylvania specifically. But overall, flu season can start as early as October or as late as January and last until April. So comparatively, last year's flu season saw cases crest about 1 or 2 months earlier than usual. And this year was more of that usual spike, which is happening around now.
Okay. So let's look at the numbers. As of February 15th, there were 153,350 confirmed cases of the flu across the state since September 29th, and 348 flu-related deaths, according to the dashboard. Now, this week it seems to be on a downtrend. Currently in Allegheny County, we've seen 12,325 cases in that same period, while Westmoreland County had 3,126 flu cases. It seems like this spike is starting to see the end that you alluded to in your story.
For sure. So Dr. Graham Snyder, the medical director of infection protection and hospital epidemiology at UPMC, told us that the flu spike, which began a few weeks ago, will likely last at least for a few more weeks in a best case scenario. So definitely through the end of February, probably into early March. He said, quote, "I would say that the rate of hospitalizations we're observing is within a usual range for influenza season. Like nationally, every single year, hundreds of thousands are hospitalized with influenza around the country."
What have doctors seen so far? You interviewed Dr. Amy Crawford-Foucher, a family physician and the chair of the Allegheny Health Network Primary Care Institute. What did she have to say?
Yeah, so she sees firsthand a lot of these people coming in who are ill, and specifically at AHN, she said she's seen a, quote, significant increase in the number of people admitted to the system's hospitals for the flu. She said, quote, "It's the height of the season, so that's what we're expecting to see." And so as of February 4th, Allegheny Health Network had 79 patients hospitalized with severe flu, according to Dr. Crawford-Foucher. And at that same time last year, the network only had 28 patients admitted with the flu across its hospitals.
So, like she said, there was definitely a height of the season, but it's nothing that wasn't expected. Dr. Snyder, as you mentioned before, also said that influenza isn't the only respiratory sickness that they've seen. There also are substantial cases of COVID and RSV.
He said, quote, "This is the first year since the COVID pandemic that we're really seeing all three of them at a high level of activity. The influenza, though, is definitely dominating."
Now, there have been many media outlets reporting on a quademic, including all three of these viruses and norovirus, but according to these doctors, it's not a signal to panic.
Yeah, Dr. Snyder said, "Just like always, yes, there are, quote, still people dying from COVID and from flu, but most cases," he said, "resolve without severe consequences." Dr. Crawford-Foucher said, quote, "Even though people feel really bad for 5 to 7 days when they have these illnesses, most won't get seriously ill."
Okay. Now, in your conversation with Dr. Crawford-Foucher, she did also express some concerns on what she believes could attribute to these rise in cases. Can you tell me about that?
Yeah, for sure. So most of the health systems are unable to comment on political matters. So often when we speak with doctors and employees of the health systems, people will sort of allude to what's going on in the political sphere currently. And Dr. Crawford Foucher said there's been increasing public skepticism and a lack of education surrounding vaccines. That was not only the COVID vaccine, but with other preventable illnesses such as the flu, which we've been discussing. She said, quote, "Are we seeing more flu because fewer people chose to get the flu shot? I'm worried this is going to be what we see more of. Vaccines are an important part of minimizing the spread." So essentially, she was just advocating for vaccines in general and making people aware of misinformation that could be going around online.
This skepticism brings me to another article that you wrote. With skepticism or dissenting knowledge, some individuals have decided to utilize unproven methods to stave off their sickness. Some of these methods include eucalyptus or other essential oils for the purpose of relieving pain or their anti-inflammatory properties, gargling warm salt water to help with upper respiratory infections, and the antibacterial and antimicrobial or sore throat suppressant properties of herbal teas with key ingredients including ginger, honey, and the topic of your story, elderberry. So, is there any point to using elderberry as a supplement?
Yeah, so elderberry has been discussed frequently online as of late. It seems to have taken up the latest online social media trend of, this is how you can get better quickly if you are in a pinch and you have a lot of stuff going on and you want to feel better. However, the Washington Post reported that a handful of small studies do show elderberry supplements may reduce the duration and severity of a cold or flu, but there is no evidence that the supplements can protect someone from catching a respiratory illness like the flu. It was actually found that elderberry supplements may shorten flu symptoms by 4 days compared with a placebo, but international travelers who caught a cold recuperated faster and had fewer symptoms if they took elderberry supplements before, during, and after their flights. So there's minimal research that shows that they could be a little bit beneficial, but again, not much more than that placebo, if people are just believing that it is going to help them.
Now, in your story, you allude to Dr. Craig Hopp, the Deputy Director of Complementary and Integrative Health Extramural Research at the National Institutes of Health. And according to him, the method has yet to gain any sort of viable credibility.
Yeah, so despite people's success stories on social media, even though people are advocating that, yes, they've seen results with it, the elderberry supplement labels, which say they support immune health, have not been verified by the U.S. Food and Drug Administration, and the products have not been proven effective, quote, for any health purpose, according to the Post.
Okay. Now, there is a professor who decides to test the supplement and do an experiment to see about its viability for himself. Tell me about Michael Macnin and what he had to say about his results.
Yeah, so according to the Washington Post, Michael Macnin was very, very excited about the possibility of elderberry working to combat these respiratory illnesses. So that's what basically drove him to complete the study. He is a professor emeritus of pediatrics at the Cleveland Clinic Lerner College of Medicine. And he told everybody through that Post article not to waste their money on the supplements, quote, until there's more information. His study found no evidence that elderberry supplements helped adults and children in the emergency room with the flu.
Okay. I remember reading in your story that he even bought a lot of elderberry supplements in various forms to try and work through this experiment and ended up throwing most of them away at the end. So it seems like there is no miracle cure-all homeopathic method, but there are some tried and true preventative practices. Corey Flower, Chief of General Pediatrics and Adolescent Medicine at the University of North Carolina's Department of Pediatrics, gives us some of these practices.
Flower advocated for a healthy, wide-ranging diet, exercise, proper sleep habits, vaccination, and of course, washing your hands. And this was according to the Post. She said, quote, when it comes to preventing infections like colds and flu, there's just no substitute for hand washing and vaccines. Similar to the first article that I wrote about the flu, when I talked to local practitioners in the Western Pennsylvania area, their number one suggestion was also washing your hands. That is the best thing that you can do to prevent flu, cold, any other viruses.
Okay. Now, your articles also talk about nasal irrigation. Can you tell our readers a little bit about that?
Yeah, so as an alternative to the elderberry supplements, which are not proven to work, nasal irrigation is the practice of rinsing your nasal passages with salt water to help remove mucus and debris. It also hydrates the nasal passages and reduces swelling from the common cold. So not only can it reduce those symptoms, but it may shorten the duration of cold symptoms and reduce the levels of the cold virus in your nasal passages as well. So this is considered a low risk treatment. It's cheap, it's safe according to the Washington Post, and it is one of the best studied non-pharmaceutical treatments for nasal symptoms, including respiratory infections and even allergies.
Okay. So, like we heard here, all different tried and true ways to prevent getting the flu. Now, in the event that you do wind up with the flu, some practices to keep yourself healthy and prevent the spread to others are utilizing antiviral medications, isolating yourself from others, covering your mouth and nose when coughing or sneezing, trying not to handle food items or dishes, and cleaning and sanitizing any surfaces that you touch on a regular basis. So, thank you, Megan, for coming on to investigate this topic and to help bring updated information to Western Pennsylvanians on an ever-changing aspect of our day-to-day life.
Thanks for having me.
Thanks for joining. If you enjoyed this week's episode, share the podcast to help keep Western PA locally informed with insightful discussion and the latest news from your area. It's an easy way to spread the word, and it helps our podcast reach more people like you. Don't forget to follow us on Spotify and turn on episode notifications so you never miss new content. Once again, I'm Zac Gibson, and this is From the Newsroom.